Our next speakers are Dr. Lenore Resick, who is a clinical professor at Duquesne University School of Nursing, the Noble J. Dick Endowed Chair in Community Outreach, and the director of Duquesne's Family Nurse Practitioner Program and Nurse Managed Wellness Center. And also Lydia Greiner, who is a psychiatric nurse practitioner who teaches public health nursing at Fairfield University in Connecticut and psychiatric nursing at California State University, San Marcos. They will be discussing stress. Please welcome Dr. Resick and Ms. Greiner.
We wanted to switch it up a little bit for lunchtime. So we thought we'd sit and do a little dialogue here.
Let's talk about stress. We're under lights here, so yeah. Is it hooked up there? Thank you. Can you hear me? Okay. You can't hear me? How's that? Better? Okay. Well, today, Lydia and I are going to talk about stress and health in Voices from the Gas Field. Actually, we're going to be talking about two studies that we were both involved in the same area, and we actually did it independently. We didn't know that we were doing studies in this area until after the fact. And then when we talked about our findings, it was very similar, and we thought that this was very interesting because I came at it from a qualitative methodology, and Lydia's group came at it from a quantitative methodology. So what we thought today is we were going to have a dialogue between the two of us, and then hopefully as the questions start, we can have a dialogue with the audience. But here's our plan. We want to do an overview of the issue and the kind of work that we were doing and the kind of study that we did. And we want to introduce our prospective studies, our methodology, and what we had hoped to accomplish while doing the studies. And incidentally, we didn't do the studies alone. We were with a team. We'll present the data collected in the study, and then we'll discuss the findings together. And we're hoping, again, that this back and forth dialogue will be an effective way to demonstrate the work that we've done. You probably all have seen this billboard or on the internet or have seen it on television. And every time I see it, I'm thinking, yeah, you're really right. Drilling is just the beginning. It involves so much more. So much more is involved in this process, and we've been talking about that through all of the speakers this morning. Just some background. Reports on the environmental health advocacy literature, the lay literature, and investigative reporting in the lay press suggest that residents in communities where unconventional gas drilling has taken place suffer negative health effects. And we've talked this morning about some of the negative health effects of the skin rashes, the breathing problems, the neurological problems, and the emotional problems. But there's a lot of anecdotal evidence. And it's really too early right now to really do any type of epidemiological studies.
So this is where, is this working okay? Good, okay, great. This is where we are both working, smack in the middle of the Marcellus Shale region in southwestern Pennsylvania. The next one, Lynn, thanks. And just in case you're not sure what we're talking about, we thought we'd throw this slide in. Some of you probably have pretty low blood sugar levels right now, or else you're in that post-lunch snooze phase. So we're not going to belabor the process of fracking because we've heard far more detailed reports than we could give today. But this is a great map to give you some idea, if you don't have it already,
of the level of drilling activity in the part of the country where we are working. One of the challenges with a map is that it's really a flat representation, and it hides what it means to live in this part of our country. And our experience, and as what we've heard today as well, is that much of the drilling and related industrial activity happens really close to residential areas, schools and parks and farms. And so what we're hoping to talk to you about today and share with you today is the experience of some of those folks who live in proximity to the industrial activity. There you go.
So, just to talk a little bit about the qualitative study. The qualitative study, just the method in general, as the one I will describe today, the researcher goes into the field really without a preconceived notion of what the variables may be. The questions are open-ended, such as, tell me what health means to you. How do you know when you're healthy? Tell me about a time when you felt healthy. Can you describe that to me? So the data is gathered from interviews, and meaningful concepts are pulled out. And this method of research is often conducted with vulnerable populations and those individuals whose voices may not be heard in the mainstream. So this type of research gives voice essentially to the voiceless. This particular study that I was involved in really was initiated by a group of women who approached me and said to me, you know what? No one's listening to us. No one's paying any attention to what's going on. And I'm a family nurse practitioner, and they were seeking some help about getting their voices heard. We focused on the women in this study because it's often the women that are the gatekeepers for health in a community and in their families. So we focused on them, and we focused also on this group of women with this particular type of study because they said that no one was listening to them. In this type of study, trust is really important. It's an important issue because these participants in the study share their personal beliefs, what things mean to them, what a phenomenon means to them. So my colleagues in this study, Dr. Joyce Nestrich and Dr. Mona Counts, they're also family nurse practitioners as I am. All three of us are from the region, and Joyce and Mona have a practice in this area, and we're seeing many of the clients. Lindsay Pizzuto, who was also on this study, was one of my students. So the area and the residents and where we were very they were known to us. The purpose of this study, this qualitative study, was to understand the meaning of health in the context and the environment of the women who lived in this region. And the research question was, what is the meaning of health in the context of the environment for the women who lived in this mid-Appalachian region? The participants were 14 women who were between the ages of 35 and 89, and they resided in 3 counties in southwestern Pennsylvania. And the participants were interviewed twice between June and August of 2012. And we started this particular study by asking the women, tell me what health means to you. How do you know when you're healthy? Can you describe this experience to me? And can you tell me about your health in the context of where you live? The interviews were completed in private homes, usually around a kitchen table or in the living room couch. And the women were interviewed twice. The first time, the interviews were audio taped, and the tapes were transcribed. Themes were pulled out or were extracted from the interviews. And with the second interview, we went back to talk to the women to verify, is this what you meant when you said this? Did we understand this correctly?
One of the things that I'd like to say before I talk about the study is I have had the good fortune to become involved with the Southwest Pennsylvania Environmental Health Project. And that is that's the organization that I worked with actually to do this project. At Southwest PA Environmental Health Project, we recognized the need to learn more about the emotional health of residents in the region. Our nurse practitioner consistently heard her clients saying that they were worried or depressed or stressed, some of them to the point where they were having problems with interpersonal relationships with family and friends. So we used a very different approach than Lenny and her colleagues. We partnered with a local community clinic because their administration had expressed an interest in possible health effects associated with fracking. So the purpose of this study was to investigate the relationship between environmental changes associated with fracking and emotional health. And it was a quantitative study, different than Lenny's qualitative study. We thought that people who lived in communities with more intense extraction activity would have poorer health than people who did not, who lived in communities with less activity. So we invited any adult who walked into the community clinic between the November 29th and January 28th, November 29th of 2012, January of 2013, if they would be willing to fill out a survey, participate in a study to learn more about the health of people who lived in their county. It didn't matter why they were there, so they could come in because they were sick, or they were getting their teeth cleaned, or they were coming for a flu shot, or they were simply someone who was bringing a family member or friend in for a visit. Okay. I'm sorry, Lynn. We asked them to complete 2 sets of questions. One is called the SF-36, which is a paper and pencil survey, and the other is another pencil and paper survey, the Index of Social Control. The SF-36 measures emotional and physical health status and function on a day-to-day basis. There are 36 questions, and they measure 8 different kinds of things. So general health, physical function, the ability of you to fulfill your physical role, how much bodily pain you have, your sense of vitality and well-being, your social function, your mental health, and your ability to fulfill your emotional role. So basically, people answered questions like this. In the past 4 weeks, how much of the time have your problems with your physical health limited you in the kinds of activities that you do, or caused you to have difficulty performing your work? Alternatively, in the past 4 weeks, how much of the time has your emotional health contributed to your accomplishing less than you would like to, or you did your work less carefully? And people said either all of the time, most of the time, some of the time, little of the time, or none of the time. The Index of Social Control asks people how strongly they agree or disagree with statements like, the really good things that happen to me are mostly luck, or I am responsible for my successes. So it tries to assess how much control people think they have over the good and bad things in their lives. We also asked a few questions like their age and their sex, and importantly, their home address. We did not ask people their names. We asked them their address because we wanted to be able to characterize the communities in which they lived in terms of how much natural gas extraction activity was going on. The SF-36 was chosen as an instrument, as a survey, because when we talked with the people at our community clinic, our partners there, they said if you come in and ask people to fill out surveys that specifically look at mental health, you're unlikely to get people to fill them out. That's based on our experience working with these clients. So as a result, we chose the SF-36 because it's a more general set of questions. Next, thanks, Lynn. So our community level measures. We were able to get from the DEP the number of active wells in the township in which the person lived. And we were also able to get the number of wells that had been drilled in the past 12 months in that same township. And for the town or community in which they live, we were able to use data from the US Census to figure out what the per capita income was in that community, as well as what percentage of the residents lived below the federal poverty level. So that's how we tried to characterize the place where each person lived. So now we're going to switch focus back to our qualitative data, and we're going to try to use photos to link the fracking process to the voices of the women. And we're going to start with seismic testing, because that is usually not the first thing that comes to mind when we think about the impact of this industry on residents.
So the data we collected in the qualitative study, the voices of the women, are going to be threaded through these next several slides. The women described the concern for safety related to the unexpected experience of strangers walking on their land and on their property. One of the women stated, "The seismic testers, they're traipsing all over our land. They're doing seismic testing. We never locked our doors before, and now we have to lock our doors because we don't know who these people are. They didn't even ask us permission to come here." There was expressed fear of the increased traffic and trucks and the killing of pets and the killing of animals on roadkill. One woman stated, "Just the trucks up and down the road 24/7, it's a constant aggravation. The truckers can hit small pets. They killed a small dog not too long ago. They run over things." This powerlessness was compared to an invasion. They said, "It's like the television show The X-Files, where the white trucks come in." The women described the essence of health and where they lived. In the context of the environment, one woman said, "Before it all happened," I'm talking about the drilling in the frack water waste pond near my home, "I feel like we were healthy. We did all kinds of stuff outside, and that's how we lived. We worked on our small farms. And that's what health meant to us. We could be outside, we could be active. And since then," that's after the drilling and the fracking began, "we haven't been able to live that way." Another woman said, "No one will listen to us. I'm afraid to come home. I go away, I feel better, I come back, and I feel sick." The environmental changes were associated with changes where they lived, and in phenomenology is considered lived space. The women described being forced from their home due to the chemical exposures, constant light, and noise. One person remarked, "We're afraid to come home yet because we don't want to be re-exposed. Since we've been away from the chemicals, it's better. And we're even trying to live right now in 3 different places." The women expressed a lack of transparency that resulted in the distrust of the companies, the local government, and regulatory agencies. This is a distrust that they said that they had not experienced before. One woman summed it up. She said, "I compare it to The Matrix, you know, the movie. There's the red pill and there's the blue pill. You can take one of the pill and life is fine and things are good. But you take the other pill and you know. And once you know, you cannot not know. It's like all the illusions, all the things you thought were true, they've been stripped away from me. And then you realize you've been living here in this country. It's a massive illusion and a web of propaganda. We're not in control of our lives here. The communication channels have been taken over by the industry. You can see it from the ads." Another woman stated, "It's like living in a science fiction movie. I feel like I'm in a bad dream and I can't wake up, and no one will listen to me. They just don't care." Concerns about air quality were expressed. The presence of a sweet metallic taste was described to me over and over again, and it was described as causing headaches, and these headaches and this taste prevented the women from working outside for long periods of time. And this was a great issue for the women I talked to who worked on small farms. One woman stated, "We were tested for chemicals we were inhaling off the impoundments, and it came back showing that we had moderate levels of benzene and toluene in us. So it was like once we got the water mess fixed up, now it was the air was making us even more sick." And especially when the weather started getting hot. And remember, we interviewed these women in July and August, and I don't know if you remember in 2012, but it was very, very hot. And they were talking about how the air wasn't moving and they couldn't go outside. And some women even had plastic taped on their windows to keep out the smell. Many women stated about the noise. One woman summed it up: there's so much noise 24/7. There's lights on all the time with the flaring. My nice, stable country life has become a day-to-day chaos, and it's unfortunate. That quiet country life is gone, and the reason we stayed here and lived here is no more. Another woman said, we had to move out because it got so bad. The smell was horrible. We had terrible headaches, sore throats, burning eyes. Our nose, our mouth, they were always burning. You can't even swallow. You can't breathe when you're outside. Nearly everyone we interviewed in their homes were dependent on well water for drinking water. The women expressed changes in the well water, often described, they also at this time described the mistrust in their lifelong neighbors. They described neighbors turning against neighbors. One woman summed up her experience. She said, it's a crime against humanity. You have to tell someone if you're getting poisoned with your water and you know it. The participant was irate because her neighbor knew the water was contaminated but didn't tell others because of a contractual agreement.
So we're going to shift gears once again and go back to the quantitative study, and I'm going to tell you a little bit about what our results are. And as some of the other speakers have said, these results have not yet been peer reviewed. I'm starting to sound like a broken record. We have a manuscript that's been prepared and we are submitting it, so these are preliminary results. We had 239 residents who lived in one county in southwestern Pennsylvania who completed our survey. The majority of them were women. The majority of them were not employed outside of their home, and most of them were clients at the clinic. However, 33% of them had come in that day when they filled out the survey, not because they had an appointment themselves. They came in with a family member or friend. About 18% of them came in for dental appointments, and then the other 25% or 20% or so came in for either a sick visit or what we call a well visit. They came in mostly for flu shots because it was flu shot season. The average age of these people in our participants was 48, but we had people as young as 18 and as old as 85 who completed the survey and participated. Okay. To give you an idea of the health and function of the people who completed our surveys, you can see the first 4 bars on it's your left-hand side of the slide, are the physical function measures: general health, physical function, your physical role, and your bodily pain. And between 23% for physical function and 37% for bodily pain had low scores on those measures. Low scores are bad. They mean poor health. On the right, vitality, social function, mental health, and role emotional, those are the mental health component scores. The most important bar on this chart is the very last one on the right that's got a big red star on it. That's the mental component summary score. If you have a low score on that, it is the same as scoring positive on a screen for depression. And 31% of the participants had a low score on the mental component summary. You would have expected about 19%, so 31% is high. This is a snapshot. We're not making any kind of cause-effect statements. We're simply saying in this group, in this sample, a convenient sample, this is what their health and function looked like. Okay. We're going to spend a little bit of time now dialoguing about our findings.
One of the important findings from the qualitative work is that place matters, and that the essence of health was related to the proximity of one's living space to an industrial site. The women spoke a lot of being forced out of their way of life and the way their family had lived for generations. One woman summed it up. She said, "We live here for a reason. My great-grandfather lived here. My dad grew up here. I love my kitchen. And I mean, it's just a house, and my kids' health is not worth us staying here. But at the same time, it's our house, and we want to be here." The women spoke about uncertainty about long-term health effects, especially with the environmental changes going on so close around them and their health. One woman summed it up. She said, "They drained all of the chemicals out from the wastewater pits about 2 to 3 weeks ago. I bought cancer insurance for all of us and my family just before it's too late, just so we're ready for whatever the future brings."
So in terms of the quantitative study, place matters also. What we found was that the level of drilling activity in the township did not appear to be related to emotional or physical health and well-being. When we did our analysis, the individual characteristics were associated with scores on the SF-36 with physical and mental health. However, when we added the community level variables to the model, there was no significant relationship. The way we understand that, particularly given the qualitative results that Lenny's discussing, is that the number of wells in your township does not in any way reflect your individual experience with natural gas extraction and all of its related activities. So for our interpretation of these results is that we need to have I should say, more precise measures of proximity and exposure to industrial activity than simply the number of wells drilled or the number of wells active in your township.
In the qualitative study, the women described many themes of powerlessness that affected their health and their living space. Powerlessness was described as a lack of respect, injustice, and or blaming the victim from the region. One woman said, "We might be country, but we aren't stupid." One woman described, "I was accused of poisoning my elderly father because he got sick at home, but improved once he was in the hospital. I realized later that it was I who was giving him the contaminated well water at our home because he had a catheter in. I was encouraging him to drink. I didn't know that the well water was contaminated." The closer the women lived downstream or downwind from some or part of the industrial site, the more they expressed these feelings of powerlessness over health and the environment. But some of the women we interviewed lived further away from the drilling, from the fracking pits, the flaring, and the compressor stations, and they expressed an awareness in the changes of the environment, but they described no immediate health concerns because of the distance of the living space they had from the industrial activities. One woman stated, "I really haven't any concerns about health and the environment. I know a lot of people are talking about the wells that are going up in the Marcellus Shale. I really don't know what it all means, and there's none near me. I mean, there's some, maybe like 4 miles, but that's just come up in the last year. I don't think that has much to do with any health issues that I've seen." But those closest to the wells had a different experience. One woman voiced, "We're 1,000 feet, and my neighbor is about 500 to 700 feet from an open fracking pit. And then there are 2 houses right immediately below this pit. We didn't even know it was there. We thought it was just a well pad. Then someone at one of those community meetings showed me a picture of it. I was floored. I couldn't believe that that was going on where I'm living, right under it. I never knew. Nobody told me. We knew nothing."
Lenny and I were struck, and our colleagues were struck by the congruence of our findings on the issue of powerlessness or sense of control. While some of the individual characteristics were associated with measures of health and function, for example, age, I'm sure you will not be surprised to hear, was inversely related to physical function scales. So, for example, the older your age, the lower your score. And as an older person, I can say that with impunity up here. Being a clinic client was inversely related to physical function, mental function, and vitality. So if you were a clinic client, it was associated with having lower scores. If you worked outside the home, the relationship was reversed. You working outside the home was positively associated with your health and function. But each one of those characteristics was only associated with 1 or 2 or perhaps 3 of those 8, remember, subscales? Sense of control was associated with all 8 subscales and the 2 composite scores, and it was associated in such a way that the higher your sense of control, the better your scores. So those folks who had higher sense of control had better scores on their SF-36.
So in summary, we had 2 studies, 2 different approaches going on at similar times in the same place, and we didn't know that we were both doing studies. One had a quantitative approach, the other had a qualitative approach, but both had similar findings. And the qualitative approach informed the interpretation of the quantitative findings.
And so moving forward, what we are going to do is we're getting more detailed exposure data so that we can model the distance from the wells and the number of wells and activity of wells by household to develop more precise measures. And we need to acknowledge our colleagues and our collaborators, Southwest Pennsylvania Environmental Health Project, Joyce Nestrick and Mona Counts, who worked with Lenny and David Brown, and Dale Glazer, who worked with me. You've already, Lindsay Pizzuto, a graduate assistant. We had media and technology support, without which we would not be here today, and our funders as well. And next.
And we have some references that we used for a study, and we want just to say thank you. And if you have any questions, I do think we have some time to answer them.
I tried to say something.
I have one question here and one question coming. This one is from Lenore Resnick. So she is curious as to whether the qualitative study was based on nurse theorist Rosemary Parse, and if so, can you give us some idea of the relationship? Or
Well, actually, we approached it from a phenomenological perspective without really pulling in a nursing theorist. It was mainly a phenomenological approach and a qualitative approach. So Dr. Parsi is a phenomenologist, but we really didn't pull that in a theory into our approach. We approached it totally by answering or asking those open-ended questions.
okay, thank you. I think that's it for you, unless we have other questions. Oh, we have one more. How did both studies measure distance from the well site, from the drilling site? Did you?
Our study was purely qualitative, and the women told us what it was, and actually I was sitting in the living room. They took me for rides around their community. So as I was talking to them, I mean, I didn't get a tape measure, but I could see what they were talking about. So it was actually being in the field with the individuals in their living space, and that is how we incorporated the findings. And it was their voices that was validated by going back and asking them, is this what you meant by this?
And we did not measure distance from the wells. We simply looked at density of wells in the township of residents. So our next step is actually to measure distance from the wells, and we have a GIS wizard who is helping us to get that data, and then we will do statistical modeling.
Let me rephrase this last question. Given that you are working with a clinic, how does the clinic deal with this information? Do they have the information? How do they deal with it?
Yes, we reported back to the clinic the findings of our study. We had a meeting. Well, I had a meeting with administration and staff and presented to them the findings.
So they would be the people to ask about how what their solutions or how they're advising these folks, or these are all anonymous. Is that correct?
Yes,
Okay.
yes, they are. And the data that the clinic was given back was a summary of the findings, not this person at
Okay.
this house, and it was completely anonymous and de-identified.
Okay, I think Dr. David Brown will be addressing the group shortly, and he is from the clinic, so maybe we can ask him if they're dealing with the mental and, you know, these impacts, these particular health impacts.
I will say that the response from the clinic administration and staff was that they were not surprised by the findings, based on their understanding of their clients' lives.